we begin tonight with that very welcome news today, perhaps a real weapon now in the battle against COVID-19. Tonight, the new findings from the NIH on the antiviral drug remdesivir showing promise in speeding up recovery. Dr. Anthony Fauci said the drug is effective at blocking the virus, calling the results highly significant. And he said this will set a new standard of care. Of course, this is different from a vaccine. It doesn't prevent it, but it shows the potential for real promise in treating it here in New York.
Tonight, fresh hope in the fight against coronavirus. The country's top infectious disease doctor, Anthony Fauci, announcing at the White House early trial results of the drug treatment remdesivir shows promise.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. This is really quite important. It's highly significant.
The drug, originally tested for Ebola, now showing in an NIH study it may be effective against COVID-19.
What it has proven is that a drug can block this virus.
Certainly it's a positive. It's a very positive event.
The research now needs to be peer-reviewed. For weeks, we've heard from patients who have recovered from the virus after using remdesivir. COVID-19 put 55-year-old father Chris Kane in the hospital with a high fever. He was put on oxygen. That's when he was offered the drug.
I was feeling pretty bad, so I said, sure, let's give it a shot.
Can you remember the moment the medication kicked in?
I woke up in the morning and I could breathe and it still hurt, but it had dropped off quite a bit. So yeah, it was literally 2 days later when all of a sudden I went, wow, I'm feeling better.
Kane says in his case, he felt no side effects. The drug will now be offered to all patients.
Whenever you have clear-cut evidence that a drug works, you have an ethical obligation to immediately let the people who are in the placebo group know so that they could have access. And all of the other trials that are taking place now have a new standard of care.
And in the race towards a vaccine, pharma giant Pfizer announcing their vaccine could be tested as early as next week and available for emergency use in the fall. Effective vaccine and treatments could not come soon enough.